Hi Cath, it's lovely to be here at your kitchen table chatting.
Good to see you, Sheree.
We're going to talk about the Heart of Medicine in July next year at Uluru in Central Australia, and we're just really pleased that you're a part of the faculty. You've been in this work for such a long time, asking us to think about the patients and the wellbeing of the healthcare workers and the importance of our own connection and our own sense of safety in health. What are the things that, I guess we're talking about the heart of medicine. There's a lot of science and a lot of technology now in medicine. What are the things that are important to you about having some heart in the work that you do?
I think that really brings me back to what matters and what we're all here for, and the idea that this is about humanity and about people and about how we can best look after each other and how we can treat each other.
And so is the subtext of that it doesn't matter how good the science or the tech is?
I'm very clear that the science and the technology is vitally important and is wonderful, but without the actual heart of medicine and the humanity piece, I don't think we can do the best care possible for people.
And you've been involved through the Hush Foundation and the Gathering of Kindness for, we were talking like nearly 3 decades, a long time. Real ground up movements that have come from the front line, from the clinicians themselves, from talking to patients and clinicians talking together. What's important about these movements from the ground up where the frontline people are really saying what they need and what they think would improve things?
I think it's really empowering for us to feel that we can do something in a system that's big and complex, and we can feel we haven't got much power or influence, to be able to get together with like-minded people and to share some of our concerns and share some of what we see as solutions. That is very empowering, and it means that I feel that I can do something and that each individual can do something, and we can't be necessarily waiting for the system to catch up and for the system to fix things or solve things. We have a lot of that knowledge ourselves about how we can make things better and how we can improve our work experience and our work life, and also what we can do for patients and families. So let's get on and do that.
And I'm excited to be talking with you about the parallels, I guess, between the work at the Gathering of Kindness and the Heart of Medicine. And of course, I've been at all the gatherings of kindness since the beginning. I think I have missed a couple of little bits, but principally I've been there, really absorbing and connecting and soaking up all of that good work. Do you feel like that coming together and that community is building, or that there's, what's the benefit, I guess, that you experience in people coming together in these ways?
I think it's so important that we partner and that we do this work together, and we can share our ideas and actually build on what each other is doing. And things like the Gathering of Kindness, that came out of a very grassroots idea of what is a kind health system and how can we do it together. It needs lots of voices, it needs lots of different ways to work through some of the challenges. And so I love the idea that the Gathering of Kindness, the Heart of Medicine, these tribes are really so well aligned and can work together and amplify each other.
And Gathering of Kindness, of course, has happened in Canada, it's happened in America, it's happened in Ireland. Has it happened in the UK as well? Is there?
There are elements of it happening in the UK, yes.
Certainly you've had Chris from Civility Saves Lives and, some of these other connections. Do you have a sense that, I guess, the finding of each other over time, I mean, certainly some of the other faculty members at the Heart of Medicine have happened for the same reasons, that we've connected online or we've connected during COVID, and we've been, excited to find other people of like mind. What does that do to generate momentum and I guess forward progress?
I think it really does help us to move forward, and also to feel we're not alone in this, and that the problems that we might be facing here in Australian healthcare, they are international problems, and there are different solutions to them. So once again, things like talking to Chris Turner about Civility Saves Lives, it's a different terminology, but actually it's so well aligned, and I think we learn from each other and we can sort of leapfrog even further ahead by sharing our ideas.
And maybe we can finish with if you were inviting people to the Heart of Medicine, or in fact to Gathering of Kindness, which is happening in November each year, and so we're nearly up to the next one. Like, how would you encourage people who are kind of on the fence, thinking maybe I'd like to go to that, or am I the right kind of person to go to that? Who would you like to encourage to, get involved?
I'd like to involve people from all different walks of life. So this can be medical, nursing, psychology, patients and families. I think everybody has some experience and some input that they can bring to the table and help us to all think differently about healthcare. I think we're really all needing to reach out and find different ways of doing things so that we can manage in this complex, difficult, fairly stressed health system.
So I think one of the things that you have really brought, the Hush Foundation is very focused on the arts and the value of arts in healthcare. And, I've certainly, that's been where I was first exposed to this idea through your work and the music of the Hush Foundation, the CDs. Can you perhaps elaborate to the uninitiated or the people who haven't thought of this before, why art makes a difference to our health and particularly to the delivery of healthcare?
Look, I think this came out of my own enjoyment of the arts and music and theatre, storytelling, even 30 years ago, and thinking a lot of this was missing from my actual medical work and from the environment that I was in, a big hospital. And to be able to bring that creativity and my whole self to work really was fantastic for me. And then I could see the benefits for other people, patients and families who were embracing the music and wanting to be able to tell their story so we could learn from it and experience some of the things that they understand about the health system from their story. And I've seen a lot of benefits come from that. And I think also it can help stressed health professionals to really bring some creativity into their work and their whole self to the situation.
Listening to you, I'm wondering about all those health professionals, the frontline clinicians who might say, I have to do workarounds every day that I'm at work. I'm using my creativity all the time, which is a different kind of slant to what we're perhaps thinking about. It's interesting to think of when I was, with my husband Tim in a hospital. We were very frustrated by the following of protocol, like the rigidity of the rules. And then now, of course, I'm reflecting on the workarounds that health professionals do all the time. And there's some evidence that in neuroscience that the more we use our brains for creativity, the more complex networks we have neurologically, that different parts of our brains are connected for problem solving and so on. What comes to mind when I draw all those dots together?
Look, I see it often in my work that we start to think a little bit more creatively, even because the music is on in the background or people have started talking about the music, and you can watch the cogs sort of turn and people start to think of different ways that we can solve a problem we might be looking at in the workplace. So, I really enjoy all of that, and it can bring a different part of your brain into play and really help you think differently and solve problems.
And I'm wondering, I know the huddles that you have at the Children's Hospital where you work, that you have regular huddles as a team, and that's an opportunity for people to talk about what's happening in their life or how they're showing up, how they're arriving. And certainly the huddles that we do in our Recalibrate program too, we ask people sometimes just to say one word of how they're showing up or what's the feeling that they're bringing in their body, these other ways that they can say good morning, if you like, or good evening, or hello, and share just a little piece of who they are and how they're arriving. What's important about that when we come to work in teams together?
I think it makes quite a big difference. So instead of being focused just on the policies and the procedures and the checklists that we need to go through, it is bringing that humanity into the room and how each person is showing up. And how their mentality for the day can really impact on the other members of the team. And to make everyone feel welcome, to make people feel safe, that they can bring their ideas to the table and be able to speak up if they're worried about something. It can be quite hard, particularly for junior staff otherwise. who might not know where they fit into this complex area and they'd much prefer just to step back and stay quiet. But in our huddle, we like to bring everyone in, make sure they're all welcome, and that we do want to hear from them, that their fresh set of eyes that they might be bringing to the situation can teach all of us something and can help to keep people safe.
Well, it's just the beginning of a big conversation, or the next chapter of the big conversation that we've been involved in for a long time now, and really look forward to having you with us in the faculty at the Heart of Medicine. I look forward to seeing you at the Gathering of Kindness, and thank you so much for all the work that you do in this space, Cath.
Thanks, Cherie. It's great to be on this journey with you.
Okay.